Would you like to know how to boost your score in clinical management? This is a domain that most GP trainees struggle with. Hi, my name is Dr. Erwin Kwun. In this video, I'm going to share with you practical tips to boost your score in clinical management. A common misconception is thinking that reading more books and guidance is going to help you in your clinical management. Some books are useful, however, many of the books are outdated. Reading guidance is beneficial and you want to read the guidance to know the current practice. However, in the SCA, it's important that you understand this is not just about the medical management. So if you're just reading books and guidance, it's not going to be enough. What examiners are testing is your ability to adapt your management and manage risk, uncertainty. And these are not things that you will learn from guidance or from reading books. This is when you need to practice your clinical judgment, manage risks and complexity. Most of the guidance that you've got are based on a medical condition. So if a patient is presenting with multiple comorbidities, then you need to be able to use your judgment to apply this guidance and make a plan by taking into consideration the patient's unique circumstances. Let me give you a working example. Mrs. Smith presents with heavy menstrual bleeding for the last 3 months. When you've taken the history, there is no red flags, she's not complaining or anything that you're concerned about. The reason she came for the appointment is because she's planning to go on holiday in 2 weeks' time and she'd like something to stop her bleeding. If you're going with the guidance, you might think that this patient might benefit from a Mirena to help with the heavy menstrual bleeding, and it's indeed the most effective treatment available. However, in this patient's circumstance, she might not benefit from a Mirena if she's going on holiday because it might not kick in by the time. So thinking about what might be most suitable for her, she might benefit from norestesterone so that while she is abroad, she's not having any bleeding at all. And then when she comes back, then you can consider long-term treatment, discussion about Mirena possibly, or any alternative that she might prefer. So in this circumstance, it's important that you realize that if we just go by a generic plan, it's not going to help score well for the clinical management. It's important that we tailor the management to the patient's circumstance and preference. A common pitfall is being doctor-centered in the clinical management. So often I see registrars making the decision for the patient and asking them, are you happy with that? Is that okay? When what you ought to do is making the decision with the patient, being patient-centered. So involving that patient in your decision-making and explaining the thought process and then reaching that decision together. It's really important that you understand that nuance between how you're making the decision involving the patient. For example, in this situation, you might say to the patient, I understand that you're planning to go on holiday and you're looking for something. There is a medication I'm thinking that will delay the period and that might help you so that you can enjoy your holiday. Would you like to know more about this? So you see, I'm involving the patient in that decision and explaining what I'm considering. A common misconception among registrars is thinking that just by listing various options, treatment options, they're sharing management with the patient. And oftentimes, some of these options are not appropriate. So if you're doing that, that's not how you're going to score well in clinical management. It's important that you use your judgment and offer your professional opinion what's the best for this patient, and explain what are the risks and the consequences or side effects, and let that patient understand it and make an informed decision. This is how you share the management. It's not by just listing a bunch of options, but you need to have this discussion and explain the pros and cons of a treatment and see what the patient think and help that patient to make that decision. If you found this video useful, you might want to check out a 7-day mini course. Just click the link down in the description below and you can download the SCA Blueprint and get the free SCA mini course, in which I will send you an email every day for the next 7 days to help with your preparation. Take care everybody, bye bye.